distinguished committee members and congressional staff. I am Mary Maryland, the board-certified adult nurse practitioner, speaking today.
Is the microphone on? Go ahead. Can you turn it on? There you go.
That would help.
That's it. Thank you.
Speaker Pelosi, distinguished committee members, and congressional staff. I am Mary Maryland, a board-certified adult nurse practitioner, speaking today on behalf of the American Nurses Association. The ANA is the only full-service national association representing the interests of the country's 2.9 million registered nurses. Every day, nurses know firsthand and see the heartbreaking consequences of patients having outcomes that we don't like in relationship to our nation's flawed system. We hold a patient's hand when they learn that their health insurance coverage has been canceled or denied, and on occasion we even see subsequent death related to delayed treatment. This is why ANA remains committed to the principle that health care is a basic human right and that all persons are entitled to access readily available, affordable, quality health care services. ANA strongly supports the inclusion of a public health insurance option as an essential part of reform. The public option provides broader choice for patients, increased affordability, robust marketplace competition, and ensures access to services. ANA supports provisions in H.R. 3200 that end discrimination for pre-existing conditions, ends exorbitant out-of-pocket expenditures, end cost sharing for preventative care, ends termination of coverage for those who become ill, and ends annual or lifetime caps on coverage and guarantees insurance renewal. These provisions will bring stability and a sense of security to patients who currently have insurance and to those who may lose jobs or get sick. ANA believes registered nurses are fundamental to the critical shift needed in health service delivery, with the goal of transforming the current sick care system into a true health care system. The investment in the Title VIII nursing workforce developmental programs will bolster the nursing profession. These provisions work to recruit nurses, promote faculty development, and enhance career mobility. In order to meet our nation's needs, an integrated national healthcare workforce must be put in action, including advanced practice registered nurses who provide high-quality, cost-effective care that has been widely recognized by patients and the healthcare community and industry. H.R. 3200 clearly recognizes that the support, development, and deployment of this keystone profession is essential for the success of any quality health care plan. ANA applauds the use of community-based multidisciplinary teams to support primary care through the medical home model. This model demonstrates a commitment to quality, coordinated care by all health providers and represents a focus not just on treating illness, but on preventing and emphasizing wellness. ANA is especially pleased that in H.R. 3200, nurse practitioners have been recognized as primary care providers authorized to lead medical homes. ANA supports the Energy and Commerce Amendment to create the Independence at Home pilot program, allow Medicare patients with multiple chronic conditions to receive primary care in their homes. It aims to support an interdisciplinary model which includes providers, both nurse practitioners and physicians, where they would practice collaboratively to the full extent of their education and training and licensure on behalf of the patient. It recognizes the integral role that nurse practitioners play in bringing the focus of our health system back where it belongs, on the patient and the community. ANA believes that strengthening primary care for Medicare beneficiaries is essential. Nursing care and quality patient outcomes are inextricably linked, in particular in relationship to acute and long-term care. ANA is pleased that H.R. 3200 requires public reporting for nurse staffing in skilled care facilities. Staffing information will help consumers make informed choices and promote resident safety. It is ANA's strong stand that this requirement also be extended to acute care settings as well. ANA strongly supports community-based and home-based models of care such as nurse home visitation programs and nurse-managed health clinics. There are more than 200 nurse-managed health centers They provide primary care services to over 2 million patients annually. These centers can also provide a medical home for underserved individuals and have partnered with the federal government to reduce health disparities. Thank you again on behalf of the American Nurses Association, the public, and the patients we serve for the opportunity to testify here today. Let me share with you comments from one of the thousands of nurses who wanted to have their story told to you. I quote, "I am tired of wheeling patients to the doors knowing they are not ready for discharge. I am tired of finding out the patients are not taking their medications because they can't afford them. I am tired of families losing their homes and filing for bankruptcies because of medical bills. I am tired of insurance companies deciding what patients need rather than patients and their providers making those decisions. Our healthcare system is not only in critical condition, it is on life support. We need to change it and reform it today." Thank you.
Thank you very much. Mr. Potter?
Thank you, Madam Speaker, Chairwoman DeLauro, Chairman Miller, and members of the committee. I'm humbled to